the pleasure of introducing one of our colleagues who will be speaking to us today. I'm Krishna, Choskhi. As you guys know, she's one of our new staff members who started last year, I guess now. But she's here to give us a talk on resilience and how to avoid burnout. So thank you very much. Something that is very common these days with our crazy censuses and first read every day.
Not a tall order, right? All right. Thanks so much, Andrew. So I'm gonna start. Okay. It's from Gomer blog, actually. It took me a while to kind of understand what this image was, but I must admit when I signed up to give a talk on burnout, which has become a topic of very particular special interest for me, I kind of felt a little bit like this, right? It's really hard to not feel completely overwhelmed by the amount of literature on burnout. It's hard to open any kind of journal now without really seeing an article about physician burnout or clinician burnout. And at the same time, to also not be discouraged by it and to just be discouraged by the sheer scope of the problem. So one of the things I really want to do today is to hopefully undo this narrative around burnout. And there's been a lot of, I think, cynicism and maybe disappointment or discouragement about kind of wellness initiatives as they currently stand, because we tend to think they don't go far enough. Or there's the sense that maybe thinking about resiliency actually puts the onus on individual providers when really it's the system that's sick. So what I want to convince everyone of today is that we're all actually on the same page, that the problem of burnout really is a systems level problem. And that's really where the changes need to be seen. But until we get there, and while we advocate for those changes, I want to visit some personal and collective strategies that we as individuals and as a group can maybe really adopt in our own practice, and a kind of in a cognitive reframing of sorts to help us find more joy in the work that we do. So another one from Gomer blog. So at least today's not a holiday. So. And again, I think that this really speaks to the fact that we're doing more and more to target wellness, but that maybe some of these initiatives are a little bit tone deaf and that they're not really speaking to sort of the problem that as we see it. And so hopefully we can start to address that a little bit. So there's a lot of buzz about wellness, and I think even if you're someone that doesn't naturally gravitate towards this topic as I do, it's really hard to deny that it's not completely changing the landscape of medical education and of practice. And so I think it's really important to give this a little bit of time and attention. So I want to spend a little bit of time just briefly talking about burnout, the scope of the problem. I know all of us have been exposed to a lot of the literature already in that space, but just so that we are kind of all at the same understanding of it. And then I want to spend most of the time talking about some strategies. So what is burnout? So it's a long-term stress reaction, and there's three sort of main aspects to it. And so when we think about how we measure burnout, the Maslach inventory also really focuses on this. So it's emotional exhaustion, depersonalization. So this is where that sense of cynicism comes in. So I feel like all those Gomer cartoons really seem to reflect that there's a burnout about the conversation about burnout. And a decreased sense of personal accomplishment. So feeling that your work is not valuable, that you're not valued, or that it's not meaningful. And I think the silver lining here is that it's a reversible state. So this is something that is not permanent, and a lot of these symptoms really might be temporary. Another thing that I want to kind of talk about is that we think we should define burnout as an occupational hazard. And so it's something that is just part of the work that we do. It's a risk of the work that we do as caregivers. And I think a lot of us tend to forget that it's oftentimes people that are the most compassionate and the most sensitive that are at risk for burnout. So it's really normal to feel this way, and I encourage all of us to remember that in our own practice and when we're talking to house staff also. This is just a sort of a brief difference between stress versus burnout. And so stress is okay, stress is normal, it's a part of life, but burnout is something different. And so whereas stress is sort of this overactivity or overengagement or feeling a little bit too revved up. I think we can notice that burnout really is a withdrawal and a callousness and a sense of just not caring anymore. This is an article. This was from an article written by Shanafelt and Colin West, and these are two people who've done a lot of the sort of fundamental work in this space. And so this just really shows sort of mean burnout among all physicians relative to the U.S. population, and it's about 40%. And then you can see this by specialty, and we've already been here and seen these kinds of cartoons where we've seen that as generalists we're really in one of the higher groups, so at 50% or more. And I think that something that's important for us to also remember is that as physicians we are at more risk for burnout than the general population. My husband is in consulting and always tells me I'm burnt out too. But I think that we really there's something about medicine that is particular in terms of giving us this risk. And so physicians work a median of 10 hours more per week than the general population. And 40% of physicians felt that their work schedule did not leave enough time for their personal or family life compared to 23% of the general population. So it's pretty significant. And this article was really mostly about kind of the amount of work that we do, but I think what it omits is that it's the kind of work that we do too, right? So it's really dealing with challenging situations, dealing with people at the end of life, and a lot of the sort of secondary stress and sort of trauma that we're also exposed to. And then overall, based on the Maslach inventory, which is one of the most validated tools to measure burnout, physicians will have higher risk for all three of the components of burnout than the general population. So why does this happen? It's not just about time spent at work. I think, as I said, it's really about the kind of work that we do. And I feel like William Osler kind of had a premonition about this. And so he said many, many years ago, engrossed late and soon in professional cares, you may find too late with hearts given way, that there's no place in your habit-stricken souls for those greater influences which make life worth living. It's kind of ominous, but I think that there's a sense that medicine is really a calling and that we tend to give a lot of ourselves, and it almost demands a lot of us kind of spiritually and emotionally. And I think that that's a big driver for burnout, and we'll talk a little bit more about that too later. This is kind of an infographic Academy of Medicine with some really alarming numbers. My goal here is not to scare all of us like in the middle of the day or to stress us out more, but really just to highlight that this is a problem, in terms of risk for depression among nurses, among physicians, and also risk for suicide. And I think that we've seen our community has been deeply affected by all of these things. So one of the things that I found also in my research on this was that while we have high levels of burnout, we're actually getting more burnt out over the last few years. And so I'm not sure what this is really reflective of, if there's just a change in the practice environment, if it's a sort of more reliance on administrative tasks, but what have you. But really, the change in physicians reporting more than one symptom of burnout has increased from 45% in 2011 to 54% in 2014. And so here the blue was all these different physician groups in 2011, and the orange was all the same groups 3 years later. And you can see that all of these groups are experiencing more burnout. So something is changing, and it's not really going in the right direction. So why do we see all of these new posts of wellness officers and wellness initiatives and residency wellness and med student wellness? And that's because of all the data that we've collected, and really just this alarming sense that burnout is taking a large toll on our patients, on us, and on the system at large. One of the things I actually found was that there was a study in the Lancet that showed that people who work more than 60 hours a week have a higher risk of stroke. And I thought that was really scary, So there's a lot of new data out there that really is making us heightened in terms of our awareness. And I think that we're measuring this problem a lot. I'm not really sure what we're doing to address it, and I think most of us would agree. Okay, so this is just the Maslow inventory. Has anyone ever done this before? Has anyone taken the burnout inventory for themselves? Might be interesting just to do just for your own kind of your own self-awareness. I'm sorry?
They kind of embedded in our annual survey.
Yeah. So there are three parts of it. So the first is kind of about emotional exhaustion. The second is about depersonalization, and then the third is about sort of a sense of personal accomplishment. And there are a lot of different ways to measure burnout. Another one is from the Mayo Clinic, and it's a well-being index. Okay, so I want to ask now all of you, we've kind of talked a little bit about what burnout is, scared us all into realizing how big of a problem it is. I want to ask if any of you have experienced symptoms of burnout. I can anticipate the answer. Oh, okay. So, just to kind of keep this anonymous, you can go on your phones to menti.com and type in that code. Simple, it's just yes or no. This is very gratifying. Okay.
This is the one that you're
Give you guys another minute. Yeah. So basically all of us, right? And it's human, and really as I mentioned before, it's an occupational hazard, right? So we don't do construction work where the hazard is that you might get injured. Like the hazard for us is really this. It's really burnout. And I think most of us are very compassionate, caring people, and I think that we're at more risk for it because of all of that. I'm going to ask you another question. Sorry, I'm not very savvy with this. Okay, what do you think are some causes of physician burnout? So you do the same thing, enter that code, and this is actually a word cloud, and there's a profanity screener in there, so can't do that. Is it working? Have you tried it yet? Okay, there we go. Capitalism, wow. Patience, patience, patience. Yeah, it's really cool. And so if more people say the same thing, that word becomes bigger.
So what's it?
So a lot of it is about the schedule, about the work burden, about the census. lack of work community, maybe not feeling supported by the system, underappreciation. Okay. Metrics. High senses, yeah, I feel like that's the biggest one, right? So it's kind of about systems level things, about our work environment, if we had to kind of give it an overarching name. Okay. Stress. Okay. So I think that our word cloud really approximates the sort of true picture, which is that burnout really is a systems level issue. It's very, very rarely really at the level of us or how we're dealing with things. That's one component to it. But most of the facets of burnout are about organizational issues and things like that. And so this is also made by the Mayo Clinic, and basically these are all the drive outs of burnout that they've discussed, that they've really come to in terms of an agreement. And what we can see is that at the center is meaning and work, which I think is kind of mostly at the individual level, but everything else is really about the system as a whole. And so really want to highlight that it's not about you, it's about the system. So I guess my summative statement about all of that would be burnout is a problem of too much work out of proportion to fulfillment and purpose. And so if you want to feel less burned out and more well, either you do less work, right? Or you have more fulfillment and a greater sense of purpose. But I think it's really a sense of being out of balance with those two things. This is a model for joy and practice from Stanford, and they have these reciprocal domains of physician or clinician wellness. And so there's really three. It's personal resilience, efficiency of practice, and a culture of wellness. So 2/3 of this pie are really about things beyond your own control, things that you can contribute to, but not things that you can necessarily change. So how do we create a culture of wellness, which is 1/3 of that reciprocal domain? So this is a work environment with a set of normative values, attitudes, and behaviors that promote self-care, personal and professional growth, and compassion for colleagues, patients, and self. I feel like when I think about this, I really feel that it's not about burnout, it's not about wellness interventions per se, but it's about kind of an ethos or a cultural attitude that you have at work, and I think we can all help work to create that too. I think the truth is that you can do all the yoga and sort of painting classes and happy hours, right, ad nauseum, but if you don't work with people that care about you or that make you feel valued and supported, that's really a community that is has a lot of potential for burnout. And I think a microcosm of that is when you're on service or when you're running a team, for example, the way you interact with your team, the way you kind of support them and make them feel valued or make them feel heard is also kind of supporting like a small culture of wellness, right? So you can make sure that people get home early, but if it's a negative interaction that you're having on a daily basis, then that can also give a lot of rise to unwellness. So again, a lot of this is about engaging leadership locally and more senior leadership, developing interventions, but I think it's about a larger sort of ethos of support. And I think it would be really interesting to think about wellness as a quality indicator, and there's been some literature that is proposing this too. So either divisions or departments or just can really think about the wellness of faculty as an indicator for their own progress. But I think at the end of the day, a connected community achieves wellness a lot more than a disconnected community. And so what I want to do a little bit today is to move some of the conversation from the negative aspect of burnout to maybe the more positive one, which is about fostering connection with our colleagues, with our patients, with our house staff, within ourselves, and to really kind of cultivate a sense of self-awareness too about how we're dealing with these things. So I'm going to get to the R word. Does anyone know what I'm talking about? Yeah. And I feel really kind of, I feel like it's, what did you say? Retirement. Retirement. I like that. Not yet. Not yet. So I think, again, resilience is a stressful topic for me and for a lot of us, because there's a sense that it's placing the onus for change on the individual, where I think that that's not all that it's about, right? At the end of the day, you could have the best system, but if you're not really thinking about it in an optimistic or constructive way, it might not really work for you either, right? So I think it's a different thing. So this is a set of individual skills, behaviors, and attitudes that contribute to personal, physical, emotional, and social well-being, including the prevention of burnout. So now I'm going to get to individual strategies to encourage personal wellness, and I offer these with a lot of humility. These are not things that I necessarily have accomplished myself, so I don't want anyone to feel that I'm being sanctimonious here, but it's based on some evidence, based on some literature, based on some personal kind of searching and perspectives also, and hopefully one of them will be maybe helpful for you. So the first is to develop a reflective practice. This is pictures of kids doing mindfulness, soldiers doing mindfulness, prisoners doing mindfulness. So I don't know if anyone here has tried mindfulness training. It hasn't really worked for me, to be honest. I know that it's meaningful for some people. I think it takes time for it to really take peak effect. But I think at the very least, you can develop maybe some strategies to cope with work stress, informed from the practice of mindfulness, even if it's not something you do very regularly. So it's the awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to the unfolding of experience. I think it's a very beautiful definition. And so this is a way to cultivate the practice of this can cultivate concentration and self-awareness. There's an app for this also. Again, not something that personally speaks to me, but I have had friends who've used this. Has anyone done any mindfulness work or meditation? Yeah, it's helpful. It's helpful. So there's actually quite a lot of evidence convincing for mindfulness-based stress reduction. And so this was a study that looked at a group of healthcare providers, so physicians and nurses, pre and post a mindfulness-based stress reduction curriculum. So it was an 8-week course. And basically they found, they did the Maslow burnout inventory before and after. And so they found that the scores on the Maslow inventory improved significantly in this cohort, so in all 3 arenas. What I took away from this other study that really also seemed to say the same thing was that the magnitude of positive changes from mindfulness took almost 10 months to be seen. So the way I interpreted this study was that it takes a lot of time, and I feel like for myself and for when I was doing this kind of work in residency, there was a lot of resistance to maybe mindfulness training, because there was a sense that, holding the raisin or tasting the raisin or whatever didn't really help in like the half hour that we did that exercise. And so it really just might take a lot more time to cultivate this as a meaningful practice for you. This was another study from the Netherlands, and what this showed me was that residents that had the highest baseline levels of emotional exhaustion benefited the most. So I think what this says is that it's the people who maybe are the biggest naysayers to these kinds of interventions that would benefit most from it, and that it takes a lot of time and buy-in for it to really work. Reflective writing is another tool that I have found personally really meaningful. Again, it's just a way to cultivate and promote self-reflection, and it's a mindful practice that can help us interpret and make meaning of our clinical experiences. There's a psychologist at University of Texas, Austin, who actually did some work kind of on this. And so I think his name was Jonathan Pennebaker. And what he did was ask a group of people to basically write about the worst thing that's ever happened to them. And he asked them to do that every day for 4 days for 15 minutes without really guiding them about what they were saying. And he noticed that there was a group of people who really sought to derive meaning from that trauma, to sort of understand why it happened or what it did to them or how it impacted them. And then he would follow those people as opposed to the people who just complained about what happened or were really kind of down about what happened. And the people who were the meaning makers actually were healthier and less burnt out, and overall had more resilience, as he defined it, than the people who didn't. And so there's something to be said about the way that we tell stories to ourselves, and the stories of our own lives and experiences, and the people who really have resilience are able to make meaning out of things. And so I think this has been a tool to really promote that kind of development in myself. Prioritize connecting. And so we said burnout is really a problem about disconnection. Okay, I really like this. So there's Surafel, do you know about this? I feel like the Epic Parody Twitter account. I think this is great. So somebody made an Epic Parody Twitter account from the voice of Epic, and it's really great. There's an NPR article about this, and that's how I found out about it. And so this tweet is saying, a new Epic feature will ask you, did you treat this patient as an individual? You can't close the visit until you put this for you. So I think that for me, one of my drivers of burnout really is that I feel at times disconnected from my patients because I have too many of them, or I don't have enough time, or because they're just, for some reason, there's a gap in having me be connected to them. And I think for me, that's a driver for my own burnout. And so one of the things I want to address in myself is that. So I think debriefing with your teams after challenging events is a really great way to foster sort of team resilience. Not only helps your house staff and helps the rest of your team, but also builds a sense of cohesion. Consider finding a life mentor, and this is some advice I got from someone a long time ago. So not necessarily someone for about career interests, but just someone whom you respect in terms of how they're living their life. And connecting to them in that way. Tate Shanafelt spoke about this study at SHM where in the Mayo Clinic, they basically sponsored dinner twice a month for physicians. And then the first part of that dinner meeting would be where they talked about sort of challenges or virtues of being a doctor. And then they found that had a positive impact on people's wellness. So it's become kind of part of their practice. And so now I think 4,000 doctors at the Mayo Clinic are offered these dinners. But the caveat to that is he said only 1,000 of them actually opted in to go. And so I think what this really says also is that people don't have a lot of time, or they don't want to spend a lot of their personal time on wellness activities, right? They'd rather be with their family or be sort of doing their life thing. But again, another way to maybe foster connection with colleagues. This one's self-explanatory. Take care of your physical, spiritual, and mental health by scheduling yourself first and really prioritizing yourself. Develop a personal efficiency of practice. And I think this is something that is important also when we're thinking about identifying burnout or risks for burnout among house staff also. So being efficient isn't only about trying to get out on time, it's also about trying to promote personal wellness. And doesn't necessarily mean doing a bad job. So we know that most doctors spend almost twice as much time doing administrative work as actually seeing patients. And I find that really, really disheartening. And again, I think a reason for disconnection too. This was, I thought, also kind of a harrowing study. So basically what they found here was that for every hour physicians provided direct patient care, they spent 2 additional hours at their desk. And at home, physicians spend another up to 2 hours of time doing work at home. So this is, again, one of the drivers for burnout from a systems level. But I think when we're working within this sort of challenge to really develop a efficiency of practice is self-preserving. help your team avoid burnout. I think I've talked a little bit about this too, but part of being really resilient actually is also doing stuff for other people. And so they've actually found that people who are altruistic and are more giving tend to be more resilient, which makes a lot of sense actually. But helping others really also reframe their perspectives is really therapeutic. Identifying this in your team is really important too. Focus on the why. So why are we doing this? What is the meaning behind the work that we're doing? And be open to embrace and model your own vulnerability, which I think is really important too. So I think it's important to share with colleagues and with trainees and with team members that we're all sort of susceptible to the frustrations and challenges of our system. And really, this is a way to build trust with the rest of the team. Understand financial planning as a form of proactive wellness. And I think this is something that is often left out in the conversation about clinician wellness, but I think it's a big component of it. So this is actually someone I really like and have come to know personally. He has this website called doctoredmoney.com. He's an MD, PhD pediatric neurologist called Sotiros Keros. And he actually just goes around the country talking pro bono to physicians and residents and trainees about financial planning. And his whole goal is really about empowering clinicians to think more about their financial stability and security. And I think it's a really profound thing what he's doing. Consider moral distress as a contributor to burnout. And for me, this is a big one too. So they did a study in, I think, the Journal of Psychological Trauma. There's a journal called Psychological Trauma, where they looked at two things. So they basically said that providers, so they looked at nurses and at physicians who had higher degrees of moral distress, which I'll define for you in a second, and also secondary traumatic stress, were more likely to want to leave work or to work less. So that was one. And that the thing that really seemed to cause moral distress in them was when they were providing ineffective care to patients, especially when they had other sick patients, right? So if you can read between the lines, I think that's a lot of what we do, what we feel that we do sometimes when we're taking care of hospitalized patients. And I think it's a big source of moral injury. And so moral distress, I like this definition. A lot of the work in this space has been done in nursing, actually, is when one knows the right thing to do, but institutional constraints make it nearly impossible to pursue the right course of action. Right? So not being able to give your patient that DOAC because their insurance doesn't cover it, or a patient who can't go to subacute rehab when you know that they should, or someone who needs a home health aide, as opposed to someone who probably doesn't, but they have a 24-hour home health aide, or somebody who we feel we're providing non-beneficial care and actually may be doing more harm. So I think these are all the things that we grapple with subconsciously or consciously on a daily basis, and I think they tend to weigh on us. And that's really because most of us went into this, or all of us really went into this field as a calling and with a lot of idealism. I really love this piece. This is a piece in The Atlantic by Richard Gunderman, and this was kind of in response to a lot of, to one of the studies from Tate Shanafelt about burnout among residents. And so he said, his whole argument is that burnout is really about moral injury. And so he said burnout at its deepest level is not the result of some train wreck of exams, long call shifts, or poor clinical evaluations. It is the sum total of hundreds and thousands of tiny betrayals of purpose, and each one so minute that it hardly attracts notice, which I think is really beautifully said. And what he was really talking about was, again, kind of going into the financial wellness aspect of it, that a lot of medical students, for example, might feel encouraged to go into higher paying specialties or make decisions based on for their career, just based on loans and things like that. And how that can really represent a betrayal of purpose, or one example of a betrayal of purpose. Okay, write down your mission statement. I like this a lot. What do you stand for? What is most important to you? And again, this is kind of a self-reflective exercise. But coming up with your mission statement is a part of resilience and part of taking responsibility for creating lives that are meaningful for us. And again, those missions don't need to be lofty. When I was younger, it was wanting to save the world. I don't know what that means, but it's become a lot smaller and specific now. And so as long as what we're involved in has a sense of meaning to us, that can really push us through a lot of challenges. They've done studies where it shows that if physicians spend 20% of their clinical time on things that are personally meaningful to them, so whether it's outreach, mentorship, QI work, that burnout is reduced. So I think that that's a really important thing to consider in terms of thinking about the longevity and trajectory of our own careers. Identify what it is that drives us and makes us feel purposeful, and to try to spend more time doing that. Spend time with optimistic people. There is an article in the Harvard Business Review about this, but really that optimism is contagious and so is negativity. So I think really spending time with people who are able to see the silver lining in things is really important. I liked this. This is from Viktor Frankl, a very wise person. Between stimulus and response, there is a space, and that's the power to choose our response. And I think that's also a very important reminder. Again, sort of observing your own personal narrative in terms of how we're responding to things. And this is my last slide. Just really remember that the work that we do is important and impactful. Hopefully that was helpful in sparking a conversation just in yourself. And thank you. Thoughts or I'm a writer, so I write, and I'm a connector, so I connect. Yeah, I try to connect.
I really use my mother as my life teacher. She's 91 years old. She's a teacher, and she always tells me that, I worked for 44 years, and you are all looking for work, so you have to do your work well. Because you are looking for work, so it means that you have to do the job well. So she's my life.
I like that.
Thank you.